This is for ABGs, so we have an order to draw ABGs on a patient. We're going to check the patient's chart, look to see if they're on any blood thinners or have any bleeding disorders. This would just mean holding pressure a little bit longer after the needle stick. So then we go to the patient room. Hello, Mr. Blank. My name is Trisha. I'm with Respiratory Care. I am going to get a set of arterial blood gases today. This is just veins or blood from your arteries instead of your veins, and this comes from the lower part of your arm, so we will get that drawn. This just shows how your breathing is affecting you today, and right at this minute. So we're just going to draw that and get that to lab. Can I get your name and date of birth? Okay, we verified the patient. I have my supplies. I have my syringe. I have my rubbing alcohol, my Band-Aid, my gauze pad, patient, of course, and then we have a cork for the needle, and then our little device to remove bubbles following the sample. So first, Mr. Blank, what I'm going to do is just check your arm for that artery, make sure I can palpate that artery, and I have good and strong arterial flow there. And then I'm going to see if we have enough circulation in that arm. So I'm going to occlude both your radial and your ulnar arteries, just relax that arm, and then I'm going to have you make a fist with your hand. If you make a fist and open and close it, I'm going to have you do that 3 times, and I see that the palm of your hand is blanched. I'm going to let go of the ulnar artery, and I see that your color is returning very quickly. We want that return to happen very quickly. That way we know there's circulation, good circulation in that arm for this test. So what I'll have you do is place your arm up on this little towel here. Sometimes if we extend the arm a little bit, it helps hold that artery in place and keeps it from rolling a little bit. Just like with veins, your arteries will roll as well. So we've got that hand. Just go ahead and relax that hand, and it will be a little bit of a poke. But first I'm going to cleanse the area. I'm going to rub in a circular motion for at least 30 seconds, and I'm going to clean my fingertips as well. And then I have my needle here. I'm going to pull back at least 5 cc's, if not a little bit more, to get that good sample. Remove the cap, palpate that artery, and then I'm going to insert the needle at a 45-degree angle and bevel up. So as we insert, we see the blood fill into the syringe. We're going to make sure we get enough for the sample. And then as that's nearing that, we are going to pull back and hold pressure as we pull back. Hold that pressure for 3 to 5 minutes on everyone, except for those that are on blood thinners, or if they have any bleeding disorders of any sort, we would hold that for at least 10 minutes. Put that syringe or that needle into the cork. We would hold that pressure. We've held it long enough. We're going to check the site. We're going to apply that Band-Aid to the site, and then we're going to remove the syringe from that cork with the needle into the cork, and we're going to put that syringe into the device to remove the bubbles and get that sample to his lab as quickly as we can.